Hello, check, hello. Hello, check, hello, hello, hello. Check, hello, test, hello, hello.
Raju, ¿un oro de maní? ¿Un oro de maní? A la que viene los días. Que viene aquí a ciudad. Aja bahan dulu.
Hello, check. Hello, hello, hello.
Ese.
Hello, hello, hello. 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 Hello.
মিনিমাম দেওয়া আছে
Hello. 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 Hello.
আগের যেটা ছিল ওইটা নেবে কিন্তু হ্যাঁ এটা ব্যাকআপ হ্যাঁ
Hello. Hello. Hello.
Hello, mic check. Check, 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 check. Hello. All right, all right. All right. Good morning, ladies and gentlemen. Director sir, advisor sir, scientists, SPM NIWAS, dignitaries and participants from across the safe water ecosystem. We have a diverse set of participants and partners present in this August gathering, from academicians to development partners to startups and innovators and government officials, state government officials. I'd like to especially welcome the participants from the states. We have a great representation here today. I'd like to welcome representatives from Assam, Gujarat, Madhya Pradesh, Odisha, Punjab, Bihar, Andhra Pradesh, Haryana, Ladakh, and West Bengal. A very warm welcome to all of you at the SPM NIWAS campus here in Joka, Kolkata, for this one-day national level workshop on strengthening chlorination for safe water supply. Since time immemorial, water is considered a purifying and medicinal in the ancient Indian thought. Now, whether it is the Yajurveda, which indicates the purifying quality of water, when it says, apaha pavitram pavitrenaha shuddha shuddhena shuddhyatmaha, or the Taittiriya Samhita, that considers water as the universal medicine, when it says, apo ve sarva bheshaja. Chlorine is that silent guardian in our water supply, helping purify the water from bacteriological contamination that could otherwise spread diseases such as cholera or diarrhea. We've all heard stories of villages celebrating the arrival of the Jal Jeevan mission's Har Ghar Jal, but without proper chlorination, that water can turn unfit for drinking from tap. So today we are here to bridge that gap, turning challenges into solutions, one conversation at a time. Now I'd like to request today's dignitaries to please join us on the dais. With a huge round of applause, I'll first like to request Shri Priyatu Mandal, IAS, JS, cum Director, SPM NIWAS, to join us on the stage. Priyatu sir. Thank you, sir. Next, now I'll request Shri Ankur Garg, Country Director, India, and Executive Vice President of Evidence Action, to join Priyatu sir on the stage, please. Thank you, thank you. Next, I'd like to welcome Professor Pawan Labhasetwar, Professor of Practice, IIT Madras, and former Chief Scientist at CSIR, NIRI, please. Huge round of applause, please. I'll also like to welcome Shri Mohammad Ishfaq, sir, IAS retired and advisor to SPM NIWAS, on the dais, please. And finally, I'll also like to welcome Dr. Sham Kumar Sharma, Scientist F, SPM NIWAS. Huge round of applause, please, sir. Thank you, thank you. So we'll start with the round of felicitations, please. I'll first like to request Shri Ankur Garg to felicitate Shri Priyatu Mandal, Director, SPM NIWAS. Thank you. Thank you, sir. Now I'd like to request Shri Mohammad Ishfaq, Advisor SPM NIWAS, to felicitate Mr. Ankur Garg, Country Director and Executive Vice President, Evidence Action. Next, I'd like to request Dr. Shyam Kumar Sharma, Scientist F, SPM NIWAS, to felicitate Professor Pavan Labhasetwar, please. Thank you, sir. Thank you. I'll now like to request Dr. Tapan Saha, Administrative Officer, SPM NIWAS, to felicitate Dr. Shyam Kumar Sharma, Scientist F, SPM NIWAS. Ishfaq sir, कौन करेगा? Now I'll like to request Pavan Kumar sir to felicitate Shri Mohammad Ishfaq sir, please. Thank you. Thank you. Okay. So moving on to the lamp lighting ceremony, may I now respectfully invite all the dignitaries on the dais to formally inaugurate the national workshop by lighting of the lamp, please. Shri Priyatu Mandal sir, Joint Secretary and Director, SPM NIWAS. Shri Ankur Garg, Country Director and Executive Vice President, Evidence Action. Shri Mohammad Ishfaq sir, Advisor, SPM NIWAS. Dr. Shyam Kumar Sharma sir and Professor Pavan Labhasetwar sir. Thank you. Thank you. All right. Thank you. So I'll request everyone to please rise for the national anthem now. All right, all right. So, cool. So first up, now I'd like to request Mr. Bimlesh Kumar, Director Programs at Evidence Action, who will share his warm welcome remarks. Bimlesh's insights always remind us why collaboration is the key. Please, go ahead.
Thank you, Abhinav. Good morning, everyone. Abhinav has already extended a warm welcome to you all, so I'm not going to repeat that. I would wanted to start with a quote by Kautilya in the famous book Arthashastra, where he writes about water, and then he wrote that the state has a duty to ensure clean water for its people, recognizing water not merely as a resource, but as a matter of governance and public welfare. Thousands of years later, that book was written perhaps in 230 BC, something around that, 2200 years back. Thousands of years later, we are gathered here today because both of these truths, they still remain relevant. It's my privilege to extend a warm welcome to all of you on behalf of SPM NIWAS and Evidence Action, and then to do so at SPM NIWAS, which has been the gracious host for today's workshop under the guidance of Joint Secretary to Government of India and Director Pretu Mondal, sir. I would like to begin by acknowledging the leadership that he has provided and the guidance that he has provided for his vision in bringing together this national conversation and for the partnership that Evidence Action is honored to be a part of. I would also like to thank Shri Mohammad Ishfaq sir for his guidance in shaping the direction of this workshop. A sincere thank you to the lead scientists and the entire SPM NIWAS team, the quiet effort that goes into organizing a gathering of this scale, which is rarely visible, but that we want to acknowledge it directly. To our distinguished guests and participants who have traveled from states across the country, engineers and officials from PhDs and water departments, representations from academic institutions, civil society organizations, partners from the private sector, your presence here reflects a shared commitment to solving a problem that matters enormously. We're grateful that you made the time to be here today. Evidence Action is here in a supporting role. This is an SPM NIWAS initiative, and we're glad to contribute to it. Our hope is that today's discussions, grounded in your practical experiences and the field experiences and the collective knowledge that is present in the room today, will produce something practical and actionable that can genuinely strengthen how chlorination works in rural water systems across India. I'll not take more of your time. The day ahead is quite full, and the conversations that matter will happen in the subsequent sessions. Thank you again for being here.
Thank you, Bimlesh. Thank you. Okay, so now I'd like to request Shri Mohammad Ishfaq sir, IAS retired and advisor to SPM NIWAS, to join us on the stage with a high-level briefing on our current disinfection realities. Shri Ishfaq is a former IAS officer and advisor to SPM NIWAS and provides strategic guidance and institutional leadership in strengthening India's WASH initiatives. Welcome, sir.
So, very good morning to all the esteemed dignitaries at the stage and all our esteemed guests in this hall. So, this workshop is basically on the topic of chlorination. It's a very simple topic, but we are focusing on the chlorination because chlorination is very, very crucial. Next, please. Can I hit the next slide? So, as we know that under Jal Jeevan Mission, we have made tremendous strides, and more than 15 crore households have already have access to the Nal Jal, Nal Se Jal. But now, the quality of the water is very, very important. The achievement has transformed access to drinking water and improved the quality of for million lives. The next critical challenge is the matching this massive coverage with the consistent and verified water quality so that consumer can consume it directly from the tap without any home-based secondary treatment. So this is our vision. Thank you. So no, drink from tap cannot be possible with infrastructure alone, because infrastructure alone cannot guarantee the safety, making effective and regular disinfection crucial to maintaining an uninterrupted safe water supply. What is the critical gap? The Bureau of Indian Standards mandates that the drinking water must be free from pathogenic organisms. The Jal Jeevan Mission prescribes maintaining at least 0 to 0.2 ppm free residual chlorine at every household tap. Water supplied through tap connection is prone to microbial contamination from the source down through the distribution system. Microbiological contamination poses serious health risks, including diarrhea, cholera, typhoid, particularly affecting vulnerable groups. And we might have seen many such instances in our country in the past, where even the best managed cities are also facing this issue because of lack of chlorination and other challenges in the supply of safe water to the citizens. So what is the chlorination challenge? Despite chlorination being a mandated practice, there remains a significant gap between the policy intent and the ground level execution. Selecting the appropriate chlorination technologies suited to varied local conditions and infrastructure remains a critical hurdle. Routine operational maintenance are frequently irregular due to limited technical skills and high staff turnover. Inconsistent availability of spare parts and chlorine consumables often lead to prolonged downtime and heightened contamination risk. Monitoring and documentation gaps weaken accountability as limited residual chlorine testing delays timely corrective action. Sanitary surveys are seldom conducted. These are the challenges before us. So what is the agenda for today's workshop? First of all, let us understand, today we are not doing a training workshop. So the primary goal is to identify the barriers to effective disinfection and develop practical solutions to improve chlorination. This is not a training workshop, rather an problem eliciting exercise to understand the challenges and explore their mitigation strategies. We want to hear from the policymakers, we want to hear from the private sector, manufacturers, supply chain managers, practitioners, engineers, even social scientists also, people from the non-profit organizations. So this workshop seeks to generate an experience-based insights that support the critical shift from water coverage to assured water quality. That's why we have kept one engaging group work where all the esteemed members will be engaged in some group activity, which later on our organizers will be telling you. Then we have panel discussions, and in the panel discussion also, we are not distinguished between the expert or a senior or a junior person. In fact, we wanted to listen from the people who are actually implementing the project. That's why you might see in the panel also somebody who may not be very senior in the hierarchy, but still is part of the panel, because we want to understand his ideas, his problems, or his or her situation. So with that, I wish this workshop a great success. Thank you very much.
Right. Thank you, sir. All right. I'll now like to invite on stage Professor Pavan Labhasetwar for the keynote address. Professor Labhasetwar is a distinguished Indian environmental engineer and former chief scientist and head of the Water Technology and Management Division at CSIR, National Environmental Engineering Research Institute, NIRI, where he led research on water quality, treatment technologies, and water safety planning. He holds a PhD in environmental engineering, has published extensively in water and sanitation research, and serves as a professor of practice in the Department of Civil Engineering at Indian Institute of Technology, Madras. With a huge round of applause, I'd like to welcome Professor Labhasetwar, please.
Yeah, good morning, everyone, and thanks a lot. Yeah, I would definitely acknowledge those who invited me, but it looks that NIWAS is a really appropriate name for this institute because when I come back here, I feel I'm at my NIWAS because I was associated with this institute since 2014 when it was conceptualized in Kolkata. Yeah. So, before wasting much of time, dignity of the dais now, participants, yeah, I will be talking more about strategic importance of water safety and future trends. And as Ishfaq Saab in his introduction mentioned, that chlorination is such a common technique which we have been practicing for years together, but still we find that there should be some future trends. So I have my own concept what should be the future trends. At the beginning, I would like to acknowledge director, advisor, and other persons whom I know very personally that invited me to the institute. I would also like to thank Department of Drinking Water and Sanitation, Evidence Action, of course, Central Public Health and Engineering Organization Mahua, because we came out with a manual and which is really backbone to come out with many treatment technologies. IT Madras, where I work, and CSR Niri, where I worked earlier, and participants. And this is a presentation outline. I'll have introduction. I'll briefly talk about water treatment, chlorination, and what is the future trend in which I'll have, say, more emphasis. So before I start, because I see many people here, and when I go to class, sticking to their mobile, so I request you to go to this www.menti.com all, and I have only 50 participants. So please log into menti.com first. Go to Menti, please, because I want this lecture to be both ways. Could you go to Menti? Otherwise, you can scan this. Go to menti.com. How many of you could go to menti.com and access this? So this code is written here. Just type that code. I could see 17 because we can enter only 50. So just go to this code. Oh, good. Numbers are increasing. And those who already logged in, you have to answer. Name water contaminants that have health impacts. And one of the clue I would like to give is we are in West Bengal, and the major name comes to our mind is arsenic. And other than that, I think this is great beginning. And you have named arsenic, fluoride, arsenic, iron, fluoride. Of course, sixth is bacterial contamination, which I really like the most because the disease burden because of bacteria or pathogen is much higher. So we'll now concentrate and focus more, and I'm really happy that most of you feel that we have microbial contamination as a major problem. So I'll start with a small story here, not from India, but from abroad. And this is from Walkerton, Ontario, Canada. And this has happened way back in 2000, not way back, 25 years back, and you still thought that in Canada, nothing of this sort can happen. Global water disease. So background is there was heavy spring rains. Before that, it is like 5,000 population town, and they were having like 3 wells, ground-based wells, to supply water to this city of Walkerton. And there were 2 brothers, Frank and Tom Obel, who were operating water supply, and because their father was working in Walkerton, this water supply department, so they also continued to work there. So one was foreman, Tom was foreman, and other was like in charge. So the only 2 men were looking after the water supply in Walkerton. And there were 3 wells through which they were supplying water. The well number 5 was having low aquifer, and then 6 and 7 were like deep and safe. But unfortunately, what happened on 17th of May, there was so big heavy rainfall, and this well 5 was surrounded by these cow sheds, and then cow manure actually washed into the well. And what happened? And this Tom and Frank, without chlorinating water, without chlorinating water, supplied the water. And unfortunately, these contaminants like E. coli, O157 and H7, which are pathogen in nature, and Campylobacter jejuni. This, I think you should keep in mind, this Campylobacter jejuni. This is very important. And almost 2,300 people were sick. There were 7 dead, and they lost $155 million because of this waterborne diseases. And the issue was that the failure to chlorinate. So if it can happen in Canada, it can happen anywhere. And then there was no chlorine and testing done that day. And people were very complacent, those Tom and Kebble, that they had done it. And there's a big story about it. Unfortunately, this clearly indicates that if you don't chlorinate your water supply, then it can lead to such disaster. Okay, coming back home, we have like Shimla hepatitis C outbreak, Greater Noida and NCR diarrheal outbreaks, and recurring monsoon-related contamination. These are few examples from our country. And this is very famous. When you have GBS syndrome, we call it Guillain-Barré syndrome. And this is also because of contaminated water. And you'll see this Campylobacter jejuni, because of which it had happened. And one of the reasons which has identified very clearly in Pune also, and you might be aware that many people died, and then lack of chlorination was one of the major reasons. So you can imagine that if we could have had chlorination done properly, we might have avoided this incident. Recent indoor contamination, there was a sewage intrusion into drinking water pipelines, and there was large gastrointestinal outbreak, which also highlighted vulnerability of our urban water infrastructure. You can imagine what sort of problem we might have in rural areas. So this clearly indicates that if we properly chlorinate or disinfect our water supply, we can normally avoid such instances. So water safety is not optional now. And these examples which I have given, not only from India, but even from abroad, also clearly indicate that water safety is not optional. We have to have access, but with safety. And infrastructure without disinfection is, say, false security. We feel that we are getting piped water supply, but unless we have proper disinfection in place, this security is false. And then public health actually is driven by unsafe water, and then this consequently drives disease burden. Of course, we have to have like trust and dignity in our water supply, and the communities, particularly in rural areas, they also deserve water they can rely on. I think if you read the note which had been circulated and part of the kit which had been given by Evidence Action and SPM NIWAS, if you read, I think they have very clearly included about importance of disinfection. We have achieved a lot as part of household. We have provided household tap connections to more than 15 crore household now. There is a universal coverage goal. But the next frontier, we need to shift from coverage to assured and safe quality of water. But the basic objective of having piped water supply is that we can avoid contamination or we can provide safe water at the doorstep. But there's a hidden risk in pipe systems, and early examples which I highlighted clearly give evidence that if we don't avoid this risk, we may get, say, unsafe water. And there are many contamination pathways in households. So we are like contamination right at the source itself, storage, our distribution system, and even at household also. So contamination enters at every stage. At source itself, because of surface runoff, and then water is a clear example. And animal waste, open wells. Similarly, storage. You know that we hardly clean our overhead tanks and elevator service reservoir because of which the water gets contaminated. And distribution probably is the weakest link. And the leaking pipes and intermittent water supply we have in India, because of which there's a problem of water contamination. And intermittent water supply substantially increases intrusion risk. And though CPHO stipulates that we should drink from a type of objective, but it will take definitely some time, even in urban area, thinking that we'll have 24/7 or continuous water supply in rural area, that I think is, that it will take substantial time. I'll highlight one of the study which we have done in Nagpur itself, and you can see here the coliform unit. Most of you might be knowing E. coli is an indicator bacteria, and as per BIS 10500, there should not be any presence of bacteria. But we have found out that at source we had almost 150 CFU per 100 ml of bacteria. At water treatment plant increased, but once we chlorinated, then it came down substantially. It was zero rather. And you can see the water traveled almost for 30 kilometers from treatment plant to all elevated surface reservoir. We have master balancing reservoir, and there is no bacteria in it. This clearly indicates that if you have like residual chlorine in it, that can substantially bring down the E. coli level, or we can make it zero. And this is all possible because of chlorination. But if once you go to household, and this high is high income level, medium level, and then low income level. So at the tab you can see at high income level there was no bacteria. But unfortunately, because we poorly handle water, so in addition to disinfection or chlorination, we have to ensure that we have proper household water storage also, and handling practices. Okay, so we'll again go to the same mentee, and I would request you to go to this particular question. What are the water treatment options? You've seen you yourself have mentioned contaminants. What are the different water treatment options? I've shown you, say, variation of water right from source up to household. What do you think are different water treatment options we have? Water treatment. Those field engineers who work are very well aware. Okay, one I will name. If you go to any conventional water treatment plant, the first unit you encounter is aeration. Oh, sorry. Oh, I had done something wrong here. I asked this. Yes, I had not given option. Sorry. Okay, we can take first is disinfection. Second is RO. I'll go to RO. And third, I'll go for, say, UV disinfection. You remember, first is chlorination, second is RO, and third is UV disinfection. So what do you feel is the most appropriate solution for water treatment? Oh, most of you are referring to Chlorination. Okay, great. That's a great finding. Oh, there are few feel that okay, RO is also good. 4 feel that UV disinfection also should be attempted. Okay, but majority is for chlorination. Good. Okay, coming to conventional water treatment plant, you know that we have aeration because this we need to have in place, particularly for urban or multi-village scheme. Then we have this flash mixer, we add coagulant and flocculant. We have flocculator where we remove particles, and then we have rapid sand filter. And then if you see at the end, we disinfect the water. So this is like conventional water treatment plant, which is the first stage barrier for many people, particularly in urban area, but even in multi-village scheme. And these are the purpose of various units we normally provide in our conventional water treatment system, aeration, and sometimes we have to have pre-oxidation. Normally we use chlorination, coagulation, flocculation, sedimentation, and filtration and disinfection. I am sure that what are the, now we'll go again back to Menti. Because I want your feedback that I want what are the different disinfection treatment options we have with us. Sorry. So I had it here. Sorry, this water treatment, I mean disinfection. What are the different disinfection technologies we adopt in India? Just name. Chlorination, RO, yeah. Chlorination, RO, UV, yeah, rapid sand filter also for, okay, chlorination. Oh, most of you feel chlorination, but other than chlorination, whatever you feel, whatever you might have installed. Coagulation, liquid chlorine or gas chlorine. Okay. I think UV disinfection. So, a fairly good response in which I think chlorination is the dominant one because we practice normally that both in urban and rural areas. Let us see what are those. Okay, boiling. I think ozonation. UV, I think UV mentioned, and then most of you also, some of you rather, mentioned membranes. Our ultrafiltration we normally use to get rid of bacteria because RO removes, say, almost everything. But why chlorination remains the optimal option? Yeah, we have like several options, but the unmatched advantage because of residual production chlorine provides. UV and ozone, of course, didn't provide, and chlorine keeps, say, working. Wherever we actually have, say, UV or ozone, we still have chlorination downstream of UV and ozone disinfection because it provides residual, say, residual also. It has been proven at scale. We have like decades of global public health evidence. In India also, we have been using it for long, and it is cost effective. So there are like clear advantages for this. Okay, we'll just go to, say, science of chlorination, though if you have read this note, I don't have to go in detail, but I'm sure that I'll briefly talk about it. Okay, we add Cl2, then it forms both HOCl and OCl, hypochlorous acid and hypochlorite ion. And you know that we try to have more of HOCl because it's 80 times more effective than OCl. But in this case, pH management is critical. So what are the different disinfection barriers? It activates pathogen, bacteria, viruses. It provides residual protection and cost effective. What are the key parameters? So we like pH, we have turbidity and temperature. These are the three key parameters which influence impact of chlorination for disinfection or pathogen or say indicator bacteria removal. And pH, turbidity and temperature. And then one of the reasons why we monitor turbidity is because the particle reduces contact with bacteria, chlorine contact with bacteria. That's why we even sometimes consider turbidity as a surrogate to bacterial contamination. So what are the key parameters? pH, it should be approximately 7.5, and fortunately it falls within the BIS standard. And it also maximizes HOCl formation. And temperature, higher temperature, you know that if it is higher, then it will have faster reaction. Turbidity, as I mentioned, the chill pathogens, and then contact time. And we'll come to this contact time slightly later. Okay, this is very crucial, chlorine demand versus residual. So we add the chlorine here, and it is consumed initially by organics. And breakpoint is reached. Once the chlorine is consumed by organics, this breakpoint is reached. And then whatever chlorine we add after the breakpoint, it is termed as a free residual chlorine. And the target V is 0.2 ppm. And this is how it is. And then you might also be aware, if you're not aware, just ensure that. So the first stage is destruction of chlorine residual by reducing compounds. And one of them is natural organic matter. And then if ammonia is there, it forms chloroorganic compounds and chloramines. And then once this chlorine demand is exhausted, then whatever we add, it's known as a free and residual chlorine. And this formation of this free chlorine in presence of chloroorganic compounds not destroyed. And how much it should be? Like at treatment point, it should be more than 0.5 ppm. And at consumer end, BIS triplets that it should be around 0.2 or can be slightly more, but we can have like say upper limit of even 2 mg per liter also, because what we have to ensure that when we go to tail end, we have a minimum of 0.2 mg per liter or ppm of this. One more thing which is very important is CT value, which we normally ignore. So what is CT value? C is concentration into time. So unless we have proper contact time and concentration, the bacteria or pathogens will not be inactivated. See, suppose WHO recommends that we have like 0.5 mg per liter and T of 30 minutes. So the CT value should be 15 mg per minute per liter. So this we need to normally maintain. And these are the limits which I already mentioned. And Jal Jeevan Mission also mandates that FRC testing should be at 5% of habitations daily. But what are the technologies and field realities? So I'll not go to it because it's taking time, but if you are interested, I would like to know from you what are the different chlorination methods or technologies we use. So we again go back to Benti, and I'll take your feedback because you are field engineers to know more about what sort of technologies we use. Sorry. What are the different types of chlorination technologies adopted in India? So if you can name few. I'm sure you are aware of it. Chlorination, I mean. I'll give one example, chlorine gas we normally use. Other than that also, dosing pumps, okay, gas chlorination, yeah, bleaching powder, liquid chlorination, vacuum feed chlorination, okay, dosing, yeah, tablet doses, great, yeah, electromagnetic, yeah, great, I think we are coming to it, an inline chlorinator, because when you mentioned about tablets, I'm sure that you mean inline chlorination. Oh, that's really good to know that most of you are aware of it and you had read the note which had been given to you along with the registration kit. Yeah, we are like gas chlorine, high efficiency, but it's employed at urban scale, sodium hypochlorite, flexible dosing, widely available. Bleaching powder, I think most of our villages normally use bleaching powder. There are several issues. Sharmaji knows because it comes from the field. Ishfaq Saab and others, and all you engineers who come from the field. We are like chlorine tablets. Yeah, normally it's used in point of use, but it's more rural friendly. And electrochlorination, we employed several electrochlorination. I come from Maharashtra, so there also we employed several electrochlorination. It generates chlorine on, say, on site, and it's been scaled. But there's some issues with all the technologies. Yeah, but technology selection is contextual. Yeah, means we can recommend technology, gas, or electrochlorination, pump, or tablet, which you mentioned. But we have to check what is the skill of operator we have in our area. Do we have access to, say, power? If power is not available, we have to ensure that we install gravity fed, or we can choose scheme. If it is single, then we have to have like very simple technology. Whereas if we go to multi-village scheme, then we need to like gas fluorination. We can gas fluorination can work here. No single technology actually fits all. So as this is a very common saying that one size doesn't fit all. And if you're poor fit, like if you employ gas chlorinator in a 50 household scheme, do you feel that it will work? It will not work. And if we are installing dosing pump and if power supply is erratic, it won't work. And electrochlorinator will not work unless a trained staff is provided. Similarly, there's a right fit also. We can have like tablet or passive chlorinator for gravity schemes, hypochlorite plus pump for powered MVS, or electrochlorinator with dedicated operator. There are some common O&M failures, and I'm sure that during panel discussion or group work we'll definitely be discussing more about it. And we have irregular dosing, we have calibration drift, pumps under or overdose without notice. We have equipment downtime, and that also affect chlorination. And unfortunately, we don't keep any record also. So if we can make it IoT enabled, then we can have like more of records. Yeah. One of the challenge we have is user acceptance challenge. And community's perception, normally the water smells of chlorine, it must be chemical, borewell water is natural and safer, high chlorine causes illness. Whereas the scientific reality is chlorine test at safe level also. So even if you drink water having 10 mg per liter of chlorine, it doesn't actually affect health. Untreated groundwater often carries E. coli, and FRC at 0.21 ppm is safe for lifetime consumption. These are the realities. I'll skip it. I'll concentrate more on future trends. Last mile chlorination gaps, and unfortunately we are not working on this. We are happy if we maintain 0.5 mg per liter of chlorine at the treatment plant itself. Of course, we started monitoring at the last mile as well. But I think the monitoring is very weak currently. So we have to ensure that we have some tools because of which we can improve the last mile chlorination gaps. The leakage and low pressure and that free residual chlorine or free chlorine dissipates, and that contaminants enter, no consumer end testing, compliance measure at source, not at tap. Yeah, of course we mandate that it should be done, but we are very happy and we ensure, we assume that we are maintaining 0.5, it can, we can have say at least 0.2 mg per liter at the last household. And the long distribution networks, FRC decay over distance and aging time, we have intermittent water supply, the water remains within the distribution system itself, and that allows chlorine to escape. And yeah, biggest problem if we compare us with the Western world is that we have intermittent water supply, and there is intermittency related hydraulic effects. So if you go to classic literature of chlorine decay, they talk something known as a bulk decay, and there is something known as a wall decay. And the bulk decay is because of, say, presence of ammonia, which forms chloramines, and then this consumes free chlorine. We have already seen in breakpoint chlorination. If we have high iron and manganese, and then that also exerts additional demand. If you have like poorly treated surface water, that increase initial decay. And unfortunately, if you have elevated level of natural organic matter, that also react quickly with chlorine. But it has been established well in Western world that the bulk decay can be faster but it can even be slower also. So as water moves in the distribution system, then the part of these say contaminants or say constituents can affect consumption there also. We have microbial growth and contamination, pipe material and condition. There's a long residence time and poor network design. Illegal connections also contribute, and sediment desubstitution during supply cycle. So we hardly do any work on this. We presume that our pipe is fine and it's not contributing to, say, chlorine decay. And we need to really work on these aspects now. And intermittency related hydraulic effects. So when we design our water supply system, we do it for continuous water supply system. You might have heard about EPANET or water gems, and we presume that we have, say, we have continuous water supply. So during supply off period, yeah, pipes are partially empty, air gets into pipeline, sediment gets accumulated, biofilms thicken. Biofilm also gets formed. If you cut across any old pipeline, you'll find very thick biofilm in it. And then intrusion through leaks. And then on periods, the first flush carries a high contaminant load, sudden chlorine demand spike, and poor mixing of disinfectant. So that also contributes to something known as a wall decay. Okay, this is for my engineer friends. We follow this first order chlorine decay model, and it's very well established. And my request to you is that you need to ensure when you are trying to estimate how much will be the concentration at the tail end, just use this particular model and it will clearly give you how much will it be, unless there are the problems which I indicated earlier. So C equal to C0 e raised to minus, this is like, this indicates this chlorine decays exponentially. And C is the chlorine concentration, and C0 is the initial concentration, and K is the decay rate, which we need to determine both in lab and in the field also, and T is the time in minutes. So we want to determine, say, how much will be chlorine, say, after 2 days. If we are not supplying water for 2 days, then by using this equation, we can easily determine if our distribution system is intact. So as I told you, decay constant is bulk decay constant Kb and wall decay constant Kw. I'll take only 2-3 minutes, sorry. And then effect of, say, pipe material and wall chlorine decay. And this gives that CI has, say, higher decay. Even spun iron has higher decay. But fortunately, we are using MDP and PVC, which has much lower decay. So it also means that if you have like old CI pipes, the chlorine decay will be much faster than as compared to NDP or PVC pipes. And in our Jal Jeevan mission, I think we have installed these pipes. So hopefully the chlorine decay will be much lower. And this is the chlorine decay bottle, EPANET, and that this can easily be used. This is available online, and this doesn't require much of effort also. And this clearly gives that how much will be this. So this is like future trend, and then we need to really use these tools to ensure that we get predicted levels of chlorine. And this is how it gives prediction of chlorine decay, chlorine with the distance, even time also you can predict, and it matches well. Yeah, and if we make our system IoT enabled, because we have to really go for continuous monitoring, and Jal Jeevan mission also promotes that we need to convert a water supply system to IoT enabled. I think we have like 250 villages where we have already established IoT enabled. So if we combine all these, I'm sure that we'll be not only monitor, we will be even predict concentration of chlorine at the last mile, and accordingly we can adjust that how much should be the chlorine dose at the end of treatment plant. So I'll just close it with this. And safe water is not achieved at the source, but at the last step. We presume that if we ensure 0.5 mg per liter of chlorine after the treatment, it doesn't mean that we shouldn't measure at the tap. And there are many factors which contribute to chlorine decay, and we have to really work as part of our future trend. And thanks a lot. I think there's no time for question, but we can interact later. What are questions? Thanks very much.
Thank you, Pavan sir. That was a very, very insightful uh, talk. I'm sure this has set the context for discussions for the day. But before we get into the thick of things, we have a couple of panel discussions lined up. We have a workshop lined up, group discussion lined up. But before all of that, now we'll witness history in the making with the MOU signing between SPM NIWAS and Evidence Action. I would like to humbly request Shri Priyatu Mandal sir, IAS, JS, come Director of SPM NIWAS, and Mr. Ankur Garg, Country Director, India, and Executive Vice President of Evidence Action, to please come on the dais. Thank you. Thank you. Thank you. Well, now is the time. It's a pact for safe water nationwide. Please do the honors. Time for a photo op. Thank you. Thank you. What a momentous occasion. I think it's a great segue. I'd now like to request Shri Ankur Garg to address the audience and on our shared journey ahead, emphasizing partnership. Ankur, please.
Good morning, everyone. You get stuck with me without slides. So just bear with me a minute. It's just one of those classic times when technology fails to deliver when it's supposed to. It finally does. Great. Shri Priyatu Mandal sir, Joint Secretary and Director SPM NIWAS. Ishfaq sir, Advisor SPM NIWAS. Pavan sir, our guide and advisor. All the other dignitaries, eminent scientists, colleagues from the field in states, development partners, welcome. It is a privilege. Sorry. Thank you. It is a privilege to be speaking in front of you today. SPM NIWAS and Evidence Action committing to work together on strengthening state capacity, supporting evidence-based implementation, and promoting applied research at this moment in Jal Jeevan Mission's trajectory is meaningful and will leave a lasting impact in the society. All my predecessors have quoted something from scriptures, so it is my prerogative that I do the same. I'm going to go back to Mesopotamia, a civilization as ancient as ours, where civilization after civilization, people have understood one truth, which is that water is life. Where it is managed well, societies flourish. Where it is neglected, they struggle. So in ancient Mesopotamia, fresh water was personified by the god Enki. Much like in our own tradition, we've had Varun Dev as the personification of various forms of water. Our ancestors understood what we continue to learn today, that water is not simply a resource. You know, when we do like Vedic uh, chants or when we invoke Vedas, water is taken in the hand when you recite a mantra, because water is considered as something that can be programmed, right? So it is not a resource. It is the foundation of order, it is the foundation of culture, it is the foundation of civilization. Which is why at the outset, let me say that Jal Jeevan Mission has done something that most of the people in this sector did not think was possible. And at this pace, over 15 crore rural households with tap connections. I've worked in the development sector long enough to know this kind of scale does not happen without enormous political will, without institutional effort, and without real sacrifice from people sitting in this room and people like you across every single state. And that deserves to be applauded. So thank you for doing that. And precisely because of that achievement, the next question becomes unavoidable. Is the water safe, and is it available for reasonable periods of time? Functional tap connection is the foundational step that prompts the next higher order effect towards source sustainability and water quality, two pillars of the second phase of Jal Jeevan Mission. A pipe reaching a household does not on its own protect that family from cholera or typhoid or the kind of persistent diarrheal diseases that quietly erode the health of children year after year. I don't want to talk about why chlorination because Professor Pavan has talked about it, Ishfaq sir has talked about it, so I don't need to make the case. But we know from scientists, from engineers, from economists, that chlorination done consistently and correctly does save those lives. The evidence is not ambiguous anymore. We know that if chlorination done well in our own country can save upwards of 1 lakh lives, child lives every year. That means that people sitting in this room could help over 1 lakh children across our country celebrate their 5th birthday every year. That is huge, and at a rate which is extremely cost effective. So the question is not whether chlorination works. The question is why does it remain so hard to get it delivered right on the ground, consistently, across thousands of screens of different sizes, in different geographies, with different infrastructure condition that our country has. That is the problem that we are here to work on. I want to be honest here about what evidence action brings to the table and what we don't bring to the table. We bring experience in implementing large chlorination programs at scale, in contexts where supply chains are fragile, where operators change frequently, where monitoring systems are weak, and where data is unreliable. That is the real life. We've learned often the hard way what breaks down and why. We've closed programs, we've started new programs as an organization, and we bring that learning. What we do not bring is a one-size answer. And I would implore my organization to stay far from predicting a one-size answer. The technology choice that works in Gujarat may not work in Assam. The governance model that brings community trust in Maharashtra may need to look quite different in Odisha. That is exactly where this partnership with SPM NIWAS matters, because what we need is not a pilot that works in a few hundred villages. We need approaches that can be trained, replicated, monitored, and owned by systems that are owned by the state at scale. SPM NIWAS sits exactly at this junction. In my humble opinion, from having seen this program for slightly over a year and a half now, in my current role, but having worked in the water and sanitation space for much longer than this, I believe there are a number of gaps that we need focused attention on if we want to live this vision of providing safe drinking water to every rural household across the country. The first challenge is the operator. The person actually responsible, and I'm not suggesting that we sitting in this room can solve all of these challenges. Some of these will require policy input. Some of these will require engineering design challenges that can be solved in a different fora. All I want to do is table these challenges so that we can collectively think about these as we go forward. The first challenge is the operator. The person actually responsible for the dosing, regardless of what kind of sort of equipment for chlorination it is, they're responsible for checking residual chlorine, they're responsible for keeping the system running. In many schemes, that person does not have clear understanding of why what they're doing matters. That person cannot connect what they're doing day to day to the 100,000 children's lives saved vision. They do not have clear aligned incentives to perform additional duties that are required for them to perform. And it's not an easy challenge to solve. And they don't have a functioning feedback loop when something goes wrong. Training once at the start of the scheme is not training. That is orientation. We need something much more durable. The second challenge is the supply chain. Supplies running out or degrading because they were stored in the wrong way. Spare parts unavailable at the block level. These are not edge cases. They are ground realities that are faced by our partners and colleagues on the ground every single day. And every day a system runs without adequate chlorination is a day of risk that does not show up in any dashboard. And that brings me to the third challenge, which is of monitoring, that actually drives action. We have data in many places. There are two gaps. There are many gaps, but there are two primary gaps. The first gap is uniformity and reliability on data. The second is need for SOPs and protocols, which define concerted time-bound action based on data. Residual chlorine readings logged in a register that no one reviews or seldom reviews, contamination findings that take weeks to trigger a response, that gap between data and action is where public health risk lives. So we have to figure out how do we make this a high priority within our district system, within our administrative system, and that's again where SPM NIWAS comes in. The fourth gap is community trust and behavior. We can fix the operator, we can fix the supply chain, we can fix the monitoring as hard as they may be, and we can still have a system that does not deliver because the family with the tap connection does not believe that the water is safe for their child, or does not understand why the faint smell of chlorine is actually a good sign and not a bad one. We've seen this play out, a perfectly functioning system and people defaulting back to an unprotected source because no one ever took the time to explain what was being done and why. Community engagement is not a soft add-on to the technical work. It is a part of infrastructure. The taste, the smell, the unfamiliarity, these are real barriers and they don't go away on their own. They require sustained communication, trusted local voices, the kind of behavior change work that takes time and consistency. Our Prime Minister calls it Jan Bhagidari. Gram Sabhas, women groups, ANMs, local panchayat leaders, these are not just stakeholders to inform. These are people who will either sustain a safe water system or quietly let it fall apart. Get them into work, not just around it, is what makes the difference between a system that functions versus one that stops at provisioning of infrastructure. These are solvable problems, as even if I've over-problematized them, we believe these are solvable problems. As a country, we've solved these problems across a number of missions. None of this requires new science. I think what science needed to do has done. It requires sustained attention, it requires clear accountability, and it requires the kind of practical, field-tested guidance that this workshop is designed to produce. The scale that Jal Jeevan Mission has achieved is real. Now the work is making sure that scale delivers what it was built to deliver, that is water that is actually safe for drink, for every household, every day, in a consistent, reliable manner. To Priyanshu sir, to Priyatu sir, and the SPM NIWAS team, I'm genuinely glad that we are doing this together. To everyone in this room, engineers, academics, our trusted advisors and guides, civil society colleagues, manufacturers, our state colleagues, your experience is what makes today useful. We are not here to present solutions to you, we are here to think this through with you. At last, I invoke Swasti Vachan from the Rig Veda, again, in Ano Bhadraha Kritavo Yantu Vishwatabdostsu Apirata Sudbitaha, a mantra that advocates for openness, for inclusivity, for receptiveness to knowledge from diverse sources. That is the commitment that this MOU represents, and I look forward to the conversations today and from now on, not stopping with today. This is a start. Thank you very much.
Hello.
Yeah. Thank you. Thank you, Ankur. That was a very insightful discussion. Now I'd like to request Shri Priyatu Mandal, sir, IAS, JS, and Director SPM NIWAS, to share SPM NIWAS's vision outlining how we all fit into scaling success. A young and dynamic administrator, under his leadership, SPM NIWAS continues to grow leaps and bounds and emerges as the foremost center of excellence in the wash domain. Sir, please.
थैंक यू अभिनव. स्टेज पर बैठे अंकुर गर्ग, ईए इंडिया के मुखिया एंड हिज टीम, मिस्टर इशफाक, सीनियर साइंटिस्ट फ्रॉम एसपीएम निवास, आज के हमारे कीनोट स्पीकर प्रोफेसर पवन, एंड गेस्ट फ्रॉम ऑल अक्रॉस इंडिया, प्राइवेट सेक्टर, एकेडेमिया, गवर्नमेंट सेक्टर, आप सबका हमारे नेशनल इंस्टीट्यूट में स्वागत है. छोटा सा कहूँगा वहाँ पे. फर्स्ट ऑफ ऑल लेट मी जस्ट कॉन्ग्रेचुलेट एविडेंस एक्शन and also ourselves that we have got this MOU going. I'm always fond of saying कि MOU हमारे लिए at least within this government setup हमारा MOU उतना important नहीं होता है. What is more important is the intention to work together and the ability to work together. So we have been working with evidence action for a while now. In fact, 2 of their consultants are actually working with us. They are part of our family in SPM NIWAS now. So this MOU is not necessarily something that is कि ये this is just like marriage certificate है ना. So marriage बिना certificate का भी काम करता है वहाँ पे. So this certificate may or may not be there. It may be required for certain compliance issues. But उसके अलावा हम लोग मियाँ बीवी राजी आगे से ही हम लोग काम कर रहे हैं वहाँ पे. काजी का दवात से लिखा हुआ कुछ है वहाँ पे, hardly matters. So but anyways, I think this will give a structure to the process going forward. Needless to say, evidence action आप सबको पता होगा वहाँ पे is a global non-profit. इंडिया में भी इनका footprint है and इंडिया में among other things they are working in various aspects of chlorination and we hope that जैसा कि आप सबको पता है वहाँ पे कि पानी के ऊपर काफ़ी चला हुआ है काम for the last 6-7 years. बहुत ज़्यादा फंडिंग भी पूरे खास करके JJM के तहत पूरे हिंदुस्तान में बहुत सारा मिला हुआ है. Now after the initial capex part usually comes the operations part and the quality part. So धीरे धीरे हम लोग को चीज़ों को इम्प्रूव करना पड़ता है वहाँ पे कि पहले पानी का स्कीम आ जाए, फिर पानी के स्कीम का नलका लग जाए, पाइप लग जाए, एंड फिर देयर आफ्टर हाउ डू यू कीप इम्प्रूव द ऑपरेशंस, हाउ डू इम्प्रूव द क्वालिटी ऑफ द वाटर, ताकि लास्ट नलके तक जो पानी पहुँचता है वो किस तरह से पहुँचे. एंड क्लोरिनेशन एज वी नो इज़ अ वेरी इंपॉर्टेंट थिंग विद इन दैट. So again, this is a good opportunity for us, but now let me say something about this workshop, or rather what will not be covered probably primarily in the workshop वहाँ पे. I think 5 साल के बाद so far as science is concerned हम लोग इंसान लोग कुछ नहीं करेंगे है ना. AI will probably take care of all the science, all the innovations, everything है ना. 5 से 10 साल के बीच में, beyond that I don't think we'll have to apply, और मे बी हम लोग की शायद काबिलियत ही ख़त्म हो जाएगी the way we are going with attention deficit and बाकी जो पढ़ाई में दिक्कतें आ रही हैं, वी आर ऑल अवेयर ऑफ दैट. एक तो हमारा 2009 में RT राइट टू एजुकेशन ने सब कुछ खा लिया, एग्जाम खत्म करके पढ़ना लिखना खत्म कर दिया, एंड देयर आफ्टर सोशल मीडिया, नाउ AI है ना. सो इंसान वुड बी प्रोबब्ली इनकम्पिटेंट टू डू एनी साइंटिफिक थिंकिंग इन 5 years बिकॉज ऑल द थिंकिंग विल बी डन बाई AI. सो साइंस विल बी टेकन केयर ऑफ बाई will take care of itself. What will not be taken care of itself is the human relations, the civilizational thing, the cultural thing, the ह्यूमन प्रॉब्लम्स है ना. मियाँ बीवी में लड़ाई तब भी लगा रहेगा, सास बीवी में प्रॉब्लम तब भी लगा रहेगा, एंड पड़ोसी के बीच में जो लड़ाई तब भी लगा रहेगा है ना. ऊंची जात नीची जात तब भी लगा रहेगा वहाँ पे है ना. झगड़े जो है वहाँ पे हिंदू मुसलमान भी शायद तब भी लगा रहेगा वहाँ पे. इंडिया पाकिस्तान की लड़ाइयाँ भी चलती रहेंगी. ऑल दीज थिंग्स विल बी देयर. ठीक है. सो जब हम किसी प्रॉब्लम को हम देखते हैं वहाँ पे कि सो देयर इज़ द नॉलेज एंड द इंटेलेक्चुअल एस्पेक्ट, द साइंटिफिक एस्पेक्ट, विथ यूजुअली यू प्रोग्रेस एंड यू बिल्ड अपॉन what has come before. न्यूटन ने बड़ा फेमसली कहा था, आई हैव सीन फर्दर बिकॉज आई हैव स्टूड ऑन द शोल्डर ऑफ जायंट्स. मैं दूर देख पाया इसीलिए क्योंकि मैं मेरे पीछे जो बड़े बड़े दिग्गज थे उनके कंधों पे मैं खड़ा हो सका वहाँ पे. सो साइंस बिल्ड्स ऑन द प्रीवियस नॉलेज दैट देयर इज. क्वांटम थियरी इज बिल्ट अपॉन द क्लासिकल थियरी. सो हम लोग ऊपर चलते हैं, लेकिन ह्यूमन थियरी एंड ह्यूमन रिलेशंस एंड ह्यूमन साइकोलॉजी, ये सारी चीज़ें जो है उस तरह से जो होता है वहाँ पे इंक्रीमेंटल एंड कंटिन्यूअस प्रोग्रेस नहीं होता है वहाँ पे। आप सबको याद होगा वहाँ पे 2019 में क्लाइमेट एक्शन समिट में ग्रेटा थनबर्ग द चाइल्ड एक्टिविस्ट 16 साल की थी उस वक्त, तो उसने कहा था, एक बड़ा फेमस स्पीच दिया था, हाउ डेयर यू, सारे जगह पे चला था, आप लोगों ने मोस्टली आई एम श्योर आप सारे लोगों ने पढ़ा होगा वहाँ पे। तो बताते हैं कि यूथ जो होता है वहाँ पे दे बिकम वेरी डिसइल्यूजन कि जो ये सीनियर लोग हैं वहाँ पे दे आर नॉट एबल टू टैकल द प्रॉब्लम्स ऑफ द ग्लोबल प्रॉब्लम्स, द बिग प्रॉब्लम्स, क्लाइमेट चेंज है ना, बड़ी बड़ी और भी इंडस्ट्रियलाइजेशन, ओवर प्रोडक्शन है ना, ओवर एक्सप्लॉयटेशन, इन सारी चीज़ों का समस्या है। जो एडल्ट्स होते हैं दे डोंट बिहेव लाइक एडल्ट्स इन द रूम एंड दे आर नॉट एबल टू टेक केयर ऑफ द प्रॉब्लम्स बिकॉज दे आर नॉट एबल टू कम टुगेदर। ये सारे 195 कंट्रीज़ जो हैं इनमें आपस में बटे हुए हैं वहाँ पे है ना, नॉर्थ साउथ में बटे हुए हैं वहाँ पे, ईस्ट वेस्ट में बटे हुए हैं वहाँ पे। द adults are incompetent to come together and do something good for the humanity or the betterment of humanity वहाँ पे। बट देखिए बच्चे भी बहुत ज़्यादा नहीं करते हैं ना। सो द आर्ग्यूमेंट it's not a problem of adults per se। दो बच्चा आपस में कौन क्रिकेट में बैटिंग करेगा कौन बॉलिंग करेगा यही डिसाइड नहीं कर पाते हैं है ना। स्कूल कॉलेज हर जगह पे जो है बच्चे भी जो है वहाँ पे 4 बच्चे जो है एक नतीजे पे कभी नहीं पहुँच पाते हैं वहाँ पे। तो चाहे वो बच्चा है चाहे वो कॉलेज में भी कितनी झगड़े होते हैं, कितने जो है पॉलिटिकल हमारे इलेक्शंस होते हैं और उसमें कितनी सारी जो वहाँ पे दरारें होती है, वी ऑल नो वहाँ पे। तो ये जो एजेंसी ह्यूमन को जब मिल जाता है वहाँ पे, ह्यूमन हैज़ कॉग्निटिव एजेंसी एंड बिकॉज अ ह्यूमन हैव कॉग्निटिव एजेंसी थिंक फॉर इट डज नॉट थिंक लाइक ग्रुप थिंक। थोड़ा बहुत होता है वहाँ पे बट हर इंसान अपने लिए सोचता है एंड दैट इज़ वाई वेदर इट इज़ अ 5-year-old किड और वेदर इट इज़ अ 50-year-old मैन, हम लोग जो है वहाँ पे कॉमन नतीजे पे नहीं पहुँच पाते हैं एंड कॉमन नतीजों पे नहीं पहुँच पाएंगे। दिस इज द वेरी एसेंस ऑफ है ना। साइंस बोलेगा कि अच्छा क्लोरीन जो है वहाँ पे आई थिंक 1774 में इसकी जो है वहाँ पे डिस्कवरी हो गई थी वहाँ पे एंड 1810 में ये एलिमेंट जो है वहाँ पे डिक्लेयर हो गया था। लेकिन द बेनिफिट ऑफ क्लोरीन हमें पता चलने में लगा 1890 के आसपास जो है वहाँ पे इंग्लैंड में जो है सबसे पहले इसका यूज़ हुआ था इन द क्लोरिनेशन ऑफ वाटर एज अ डिसइंफेक्टेंट एजेंट। लेकिन 1890 से आज तक हम जो है कितने साल हो गए वहाँ पे, 110 + 25 135 साल हो गए हैं वहाँ पे। 135 साल में है ना। अब देखिए चैट जीपीटी बताते हैं ना वहाँ पे 3 साल में आया, कितने सारे मिलियन जो है वहाँ पे इतना जल्दी अडॉप्शन हो गया वहाँ पे। आज के दिन में इट हैज़ प्रोबब्ली मोर देन 1 बिलियन डेली एक्टिव यूजर्स। तो कितना फास्ट वहाँ पे मॉडर्न टेक्नोलॉजी आ जाता है जो लोग यूज़ करते हैं। लेकिन साइंस जो हमें पता है 1890 से हमें पता है कि क्लोरीन इज़ अ गुड थिंग एंड इट नीड्स टू बी डन, लेकिन इट नीड्स टू बी यूज्ड इन वाटर सो एज टू डिसइंफेक्टेंट। इनफैक्ट मैं आपको एक चीज़ बता रहा हूँ, आप लोग अगर थोड़ा इसको ध्यान से करें, प्रोबेबली है ना, देर आर अदर कंपिटिटर्स, उनके बारे में बताता हूँ वहाँ पे। प्रोबेबली क्लोरीन इज़ द क्लोरिनेशन एंड द कॉस्ट ऑफ क्लोरीन पर कैपिटा इज़ पर पर्सन। सो पर कैपिटा उसका कॉस्ट जितना कम है और जितना वो लाइफ सेव करता है। इनफैक्ट आप लोगों को पता होगा देयर इज दिस टर्म कॉल्ड डेली एडजस्टेड डिसेबिलिटी एडजस्टेड लाइफ ईयर्स है ना। सो पर कैपिटा क्लोरीन जितने कम पैसे में जितना सारा लाइफ बचाता है या डेली लाता है, नो अदर टेक्नोलॉजी इन द होल वर्ल्ड उतने कम पैसे में इतना जान बचाता है ना। द प्रोबब्ली ओनली अदर थिंग दैट कैन कम क्लोज प्रोबली इज़ वैक्सीनेशन। बट वैक्सीनेशन के भी जो है कई सारे चीप वैक्सीन होते हैं, कोई महंगे वैक्सीन होते हैं। सो उसका कैलकुलेशन इज़ अ फार मोर कॉम्प्लेक्स थिंग वहाँ पे। सो इतना सस्ता, इतना आसान और कुछ नहीं करना होता है। ब्लीचिंग पाउडर लो, कुछ भी लो, गोल दो वहाँ पे है ना। थोड़ा बहुत ज़्यादा भी क्लोरीन होने से हम लोग क्या करते हैं, घर में बोलते हैं कि क्लोरीन ज़्यादा हो गया, आज पानी में जो है थोड़ा स्मेल ज़्यादा आ रहा है, क्लोरीन का टेस्ट आ रहा है। बट द बेसिक फाउंडेशनल थिंग दैट क्लोरीन इज़ अ डिसइंफेक्शन इज़ नोन टू अस फॉर 135+ ईयर्स, लेकिन आज भी हम उसको नहीं कर पाए हैं। देयर आर इंजीनियरिंग प्रॉब्लम्स, देयर आर फाइनेंशियल प्रॉब्लम्स, देयर आर ह्यूमन प्रॉब्लम्स एंड ऑब्वियसली इंडिया जैसे जगह में जहाँ पे इतने सारे लाखों सारे स्कीम्स हैं और हमारे 140 करोड़ लोग हैं वहाँ पे एंड वी हैव आवर ओन यूनिक चैलेंजेस वहाँ पे है ना। एक गांव का पानी दूसरे गांव में नहीं जाएगा वहाँ पे। आई एम फ्रॉम, मेरी कर्मभूमि हिमाचल है वहाँ पे। तो वहाँ पे जो ट्रेडिशनल पानी की कूलें हैं वहाँ, कुल इज़ आपके वाटर चैनल्स। सो पानी जो अपस्ट्रीम विलेज से आएगा वहाँ पे जो है वहाँ पे वाजिबुलर्स विच आर द पुराने ज़माने के जो लैंड रेवेन्यू में जो लिखे जाते हैं वहाँ पे कि किस गांव का क्या क्या हक है, उसको वाजिबुलर्स बोलते हैं। तो वो लिखा रहता है, पंजाब में भी होगा आई थिंक, इशफाक जी भी पता है दिस उर्दू टर्म। सो बताते हैं कि हाँ ऊपर वाला फलाना गांव जो है वहाँ पे उसको इतना पानी मिलेगा, उसमें ये वाला घराना जो है उसको इतना पानी मिलेगा और डाउन स्ट्रीम में नहीं मिलेगा। अब उसके बाद जो है बच्चे पैदा हो गए, नया गाँव बन गया, तो नीचे वाले जो है डाउन स्ट्रीम जो है वो जब पानी मांगने जाते हैं उनको नहीं मिलता है, कोर्ट में भी आते हैं तो वहाँ पे कोर्ट में भी जो है कई जगह पे एडमिनिस्ट्रेटिव कोर्ट जो रेवेन्यू कोर्ट्स हैं वहाँ पे उनको मिल जाता है, क्योंकि बिकॉज दैट इज़ रिटन इन द लॉ एंड दैट इज़ रिकग्नाइज्ड एज अ लॉ। सो पानी के ऊपर झगड़ा लग जाता है। अब हाउ डू टैकल दीज ह्यूमन प्रॉब्लम्स वहाँ पे। कास्ट को लेके क्या प्रॉब्लम है वहाँ पे, यूजुअली हम दबा देते हैं वहाँ पे मेनी ऑफ आवर एडमिनिस्ट्रेटिव डिस्कशंस वहाँ पे है ना, जेजीएम के डिस्कशंस में आपको कास्ट नहीं मिलेगा। ऑब्वियसली गवर्नमेंट डज नॉट डू दिस काइंड ऑफ रिसर्च, बट आई एम श्योर प्राइवेट वाले बड़े सारे आपको बता देंगे है ना। देर इज दिस वर्ड कॉल आउटकास्ट। आउटकास्ट का मतलब ही होता है कि ही इज नॉट इवन पार्ट ऑफ द कास्ट। सो विच मीन्स कि गाँव में ऐसे गाँव के अंदर ही नहीं रहते, गाँव के बाहर उनको भगा दिया जाता है। दैट इज द ओरिजिन ऑफ द टर्म आउटकास्ट। ठीक है, तो वहाँ पे कई जगह पे अभी कई जगह पे पहुँच गया है ऑब्वियसली, आई एम श्योर वहाँ पे है ना, लेकिन कई सारी जगह ऐसे होंगे वहाँ पे जहाँ अभी भी जो है पानी के नाम पे जो है वहाँ पे डिस्क्रिमिनेशन होता है वहाँ पे। दिस इज़ देयर ऑब्वियसली, दबी दबी जगह पे हम लोग सभी को पता है वहाँ पे। ऑफिशियल जगह पे हम लोग वहाँ पे कई जगह पे बात नहीं कर पाते हैं वहाँ पे। अभी रिसेंटली कुछ जेजेएम के आने के पश्चात वहाँ पे कुछ इंटरनेशनल स्टडीज़ भी हुई हैं और दूसरे भी कई सारे होते रहेंगे अभी जैसे जैसे, बिकॉज जेजेएम इज सच ए सक्सेस स्टोरी ऑन मेनी फ्रंट्स एंड द स्केल इज सो ह्यूज कि इसके ऊपर सैकड़ों पेपर्स लिखे जाएंगे वहाँ पे है ना, छोटे बड़े, गलगोटी यूनिवर्सिटी से लेकर स्टैनफोर्ड, हर कोई लिखेगा उसके ऊपर पेपर वहाँ पे। एंड अल्टीमेटली वहाँ पे आपको जो है वहाँ पे हर प्रकार के वहाँ पे आएंगे एंड देन अल्टीमेटली यू विल फाइंड वहाँ पे कि पानी का क्वालिटी इश्यूज़ जो है वहाँ पे वो, देर इज़ वन वेरी पेपर सुर्खियों में आया है वहाँ पे, इट टेल्स हाउ certain social stratifications that pre-existed before JJM, they were accentuated because of the intervention of JJM. ठीक है, how they were accentuated. This is अभी थोड़ा बहुत हुआ है, probably दूसरे आएंगे, obviously it will require far more validation, but बड़ी सारी जो है वहाँ पे नई नई चीज़ें आएंगे वहाँ पे, but inevitably this is an incontrovertible fact कि JJM की वजह से पानी के इंफ्रास्ट्रक्चर में, जैसे कि दूसरा जो है हम लोग स्वच्छता की बात करते हुए इन दिस इंस्टीट्यूशन वहाँ पे है ना, SBM की वजह से सैनिटेशन में जो भूचाल आया है इन टर्म्स ऑफ इम्प्रूवमेंट ऑफ टोटल एसेट्स एज वेल एज एक्सेस टू वेरियस सर्विसेज इन वाटर एंड सैनिटेशन, ये जेजेएम और एसबीएम ने जो है जितना काम किया है वहाँ के पृथ्वी के इतिहास में किसी और सिंगल कैंपेन में किसी भी देश में। एंड एक्चुअली बोलना बड़ा आसान होता है वहाँ पे है ना, पहाड़ में जब आप जाएंगे ना बिल्कुल चाइना बॉर्डर के आसपास, तो आपको हर जगह पे जो है ना आर्मी ये सब लिखा, आर्मी या बीआरओ लिख के दे देते हैं वहाँ पे ना, वर्ल्ड्स हाईएस्ट बिलियर्ड टेबल, वर्ल्ड्स हाईएस्ट क्या बोलते हैं उसको, पेट्रोल पंप, वर्ल्ड्स हाईएस्ट डाइनिंग टेबल, कुछ भी डाल देंगे बोल देंगे वर्ल्ड्स हाईएस्ट। ठीक है, तो इंडिया के लिए बड़ा आसान है, कुछ भी बोल दो वर्ल्ड्स बिगेस्ट बिकॉज बाय वेरी डेफिनेशन वे द वर्ल्ड्स बिगेस्ट कंट्री एंड नीडलेस टू से हम जो भी करेंगे वहाँ पे बाई या तो चाइना करेगा सबसे बड़ा, बट चाइना भी हमसे अभी पॉपुलेशन में छोटा हो गया है। तो स्केल इज समथिंग वी शुड नेवर बी प्राउड ऑफ, बिकॉज स्केल इज समथिंग जो हम लोग को ऑटोमेटिकली मिला है, दैट इज अ पार्ट ऑफ, दैट इज अ फीचर ऑफ आवर चैलेंज, दैट इज़ नॉट अ क्रेडिट, दैट इज़ नॉट एन आउटकम कि हाँ हम लोग ने बहुत बड़ा किया है वहाँ पे। देश बड़ा है तो ऑब्वियसली इसका हर चीज़ बड़ा होगा, प्रॉब्लम्स भी बड़े होंगे वहाँ पे। सो वी विल बी डिस्कसिंग सर्टेन सॉल्वेबल प्रॉब्लम्स टुडे, देयर आर अनसॉल्वेबल प्रॉब्लम्स विच जो है वहाँ पे ऑब्वियसली वी कैनॉट हैव सच एन इंटेलेक्चुअल डिस्कशन ऑन। आई जस्ट होप कि आज का वर्कशॉप जो है जैसे बताया वहाँ पे, दिस इज़ अ प्रॉब्लम एलिसिटेशन एक्सरसाइज, वी आर ट्राइंग टू understand some of the challenges that there are. The basic purpose of this workshop is, in fact this workshop has a motive. Based on this workshop we plan to design toolkits which we will be sending to the states and will help the states and all the UTs and states etc. to design their chlorination programs etc. I'm very glad to say that next month we are also starting a certificate course on chlorination which EA is also helping us design and deliver. So again, it's a collaborative effort with Evidence Action. So this workshop is a foundational and first step in a major campaign in improving the chlorination mechanism of India. Chlorination is good. Chlorination ka science is absolutely sound. It is an old science. All we need to do so far as solvable problems are concerned, let us get more focus on it and try to arrive at a common idea as to what are the challenges and what are the solutions. So I wish all the best to all of you for this workshop, and let us hope that together we'll be able to at the end of the day, and probably as we write the documentation afterwards, we have greater clarity on the challenges and the solutions of chlorination in India than we have at the beginning of this workshop. Thank you so much. So what we will do after tea, which will be held right here, will be shift to our auditorium because I think this room is slightly stuffy. हम लोगों ने प्लान किया था एक हफ्ता पहले, तब गर्मी नहीं आया था, एक हफ्ते के अंदर काफ़ी गर्मी आ गई है वहाँ पे. We'll be shifting to the auditorium for the panel discussions, etc. Lunch will be here only, where you will be having tea. We'll again come 2:30 in here for the workshop, because this kind of setting is required, moving around, etc., and table, etc., is required for the workshop part, which is there 2:30 to 4:30. And then again after tea, we'll again move back to the auditorium, which is 1 floor below. आप लोग यहाँ से आगे चलेंगे, वहाँ पे end of the corridor you will get lift and सीढ़ी, एक फ्लोर उतरिएगा तो फिर right opposite you will get the auditorium वहाँ पे. So just the floor below. So again the ending session hopefully will again. अब again when I'm saying this, वहाँ पे है ना, you know about Murphy's law, anything can go wrong, it will. So वहाँ पे sound की कुछ शायद वहाँ पे दिक्कतें आ रही है वहाँ पे, तो I'll bear you. और सारी बोस की लगी हुई, डोंट वरी, है ना, वी हैव द वर्ल्ड्स मोस्ट एक्सपेंसिव स्पीकर सिस्टम वहाँ पे लगा हुआ है वहाँ पे. बट इवन देन वहाँ पे आई एम हियरिंग कि देयर आर सर्टन साउंड इश्यूज, तो अगर कुछ हो जाती है तो इन दैट केस प्लीज़ ब्लेम मर्फी और हमें भी माफ़ कर दीजिएगा वहाँ पे, है ना. सो टी इज़ लेड आउटसाइड, तो आप लोग प्लीज़ वहाँ पे लेट्स हैव टी, एंड देन आई थिंक 15 मिनट का ब्रेक है, 10 मिनट्स. सो 10 मिनट्स 12 मिनट्स आप लोग थोड़ा ब्रेक लीजिए वहाँ पे. वॉशरूम इज़ राइट बिहाइंड दिस साइड, एंड देन प्लीज़ रिकन्वीन एट द auditorium, which is just 1 floor below. Thank you so much.